Hi, I'm Dr. Monica Webb Hooper, Deputy Director of the National Institute on Minority Health and Health Disparities at the National Institutes of Health. The COVID-19 pandemic is on the minds of many, and specifically the COVID-19 vaccine. This pandemic has affected the lives of millions of people in the United States and across the globe. It is now one of the leading causes of death in the country. It has also created new health disparities and brought to the forefront social inequities and health disparities that have existed for many years. When we look at COVID-19 cases, hospitalizations, and death rates in the United States, the consistent findings are that African Americans, Latinos, and people from indigenous communities are experiencing a higher burden when compared to the majority population of white Americans. We are all at risk of infection because COVID-19 is spread mainly through person-to-person contact, so within about 6 feet, and specifically through respiratory droplets produced by coughing, sneezing, and even talking. A person can be exposed in many ways, and a few examples include being in close proximity to people at work, while using public transportation, places where people are gathering, or even at home. Racial ethnic minority individuals are also more likely to live in homes with multiple generations of family members, like my grandmother's home, where she may not leave home, but my cousins may spend time outside of the house for work. Families and communities being intentional about minimizing opportunities for these exposures is key to staying healthy. The bottom line is that we have a great need to end the COVID-19 pandemic for everyone, but we also need to pay particular attention to populations that are facing an undue burden. Now let's talk science. There has been lots of excitement about the first COVID-19 vaccines becoming available and hopes that a large percentage of the population will receive the vaccination by late spring or early summer of 2021. But not everyone is sharing in the excitement, and it's largely due to concerns about accepting the vaccine and the potential for harm. I understand where this hesitation and fear comes from. I do, based on my own lived experiences, those of my family, and what I have learned through my research. I resonate with and I understand the hesitation and the strong distrust for participating in clinical research and for this new COVID-19 vaccine. But I trust science and scientists. I trust data and evidence. I am a community engaged researcher myself. I've studied minority health and health disparities for over 15 years. And as the Deputy Director of NIMHD, I know that clinical research is an important component to understanding this disease and its many impacts on physical and mental health, and for the discoveries that are needed to move us to the other side of the pandemic. I also trust that the regulations that are in place for human participants in research provide protection to keep us and our data safe. And importantly, this medical advance, the COVID-19 vaccine, is critical for us to put this pandemic in the rearview mirror. Priority for me and for NIH is ensuring that we do everything possible to reduce COVID-19 and other health disparities. The data show that African Americans and other racial ethnic minority groups are more likely to say that they would not join a vaccine trial or are not willing to accept a COVID-19 vaccine if it was ready today. So I was pleasantly surprised to learn that my own parents-in-law had enrolled in a COVID-19 vaccine trial and are going through the process. Today, I wanted to share a conversation with my in-laws about their experience as research participants in a COVID-19 vaccine trial. Take a look. Hi, Mom, Dad. Thank you very much for being willing to talk with me about this topic of COVID-19 vaccine trials and the vaccines in general. I find your story and perspectives on this issue very interesting, and I'm just delighted that you are willing to share your experience with the National Institute on Minority Health and Health Disparities and the NIH audiences. So let's dive right into this conversation by you both stating your name and our relationship.
I'm Marcia Jackson Hooper. I'm a pediatric nurse, retired pediatric nurse practitioner And I'm related to Monica. She's my daughter-in-law.
And
Thank
I'm
you.
Samuel Wesley Hooper Jr. Monica is my daughter-in-law, and Otis, her husband, is my son.
Thank you. Well, let me start by asking, what made you decide to participate in a COVID-19 vaccine trial? Let's start with Mom.
Okay, well, I know I'm no longer working, but I'm still a part of the community. And I went to a conference 3, 4, 5 years ago where one of the speakers invited us to participate in trials as minorities because we have a tendency to be underrepresented. And some of this is historical fears, which I understood. So I saw an advertisement, I think on the computer, I'm not sure. Anyway, I signed up and I had to answer several questions and they said I didn't qualify. I said, okay, fine. And then about a month later, I got a phone call. Was I interested in participating in a vaccine trial? This was the third tier. And I said, sure. Because I thought that if a vaccine were to become available, I'd like to be in on it early. I know about I've done a lot of reading over the years, and I know that pandemics they take no prisoners. It's up to anybody.
Got it. How about you? Yeah.
Well, I knew that she had got accepted in the program, and I said, well, I want to contribute also, be a guinea pig. I call myself a human guinea pig. I said, well, let me see if what happens. I called them. They asked what my age and everything else, and well, I said I had COPD, and they said okay, and then they told me to come in, and then after that, everything got started. So I
okay,
want to,
please go ahead.
To find out, well, since I had something that they might need for reference as far as a person having that COPD, I said, oh, well, let me try. They said, okay, no problem, and everything.
Okay, now, from our previous conversation about this, you said that you didn't have, and I'm referring now to Mom, you said you didn't have any reservations about raising your hand to participate and rolling up your sleeves. Is that right? And why were you so sure that this was the right decision for you in terms of joining a trial for this vaccine?
Well, I think there's been enough bad publicity and press and actions over the years. And I pretty much thought that the bad things that have gone on with trials has pretty much been eliminated here in the United States. It's not all over. There are some places I know still do things that are not ethical. But I thought that with all the research that has been done, that it should be safe. And this was the third stage, so that if the first two groups made it through okay, I figured it should be okay.
Well, that's very interesting. And so you both talked about what the process was like for you to actually sign up for the trial. When you went in for the first visit, Dad, what was that like?
Oh, it was very good. Matter of fact, it was they gave a lot of cooperation as far as they asked questions, which I was very impressed as far as their presentation. And the doctor and the person that had to deal with, they were very cooperative and everything. I really enjoyed that. The interaction as far as the communication and everything else. So they made you feel as though you had nothing to fear about this, which I found very interesting.
They did send a 22 or 23 page document before we went in. And it talked about the development of the vaccines, their liability, if you got sick, what the procedures were. So they did send some pre-information, so we knew what we were getting into.
Right. You felt that the informed consent process was reasonable, and it sounds like when you went in, you felt that you were safe and you felt protected.
Oh yeah,
Very
yeah,
much so.
right,
Very much.
right. And if we got sick, they had a procedure to follow. And they did stress.
So yeah.
They did stress that we still have to wear the mask.
Oh, absolutely. I wear my mask
Right.
forever. And that's one nice thing. Go ahead.
No, I'm just mentioning because you mentioned about, what they said would happen if you did get sick. Some people report having side effects following the first or second shot. What was that experience like for you? Did you feel sick at all or have any side effects?
No sickness. My arm really wasn't even sore. Now, I don't know if we got the placebo or the vaccine. We did get communication from GW last week, and they said after the vaccine was approved, they would give us an opportunity to unblind the study. And if we got the placebo, we would be given the opportunity to get the vaccine in 1 to 2 weeks. So we haven't heard any more from them. So I would assume next week sometime we should hear from them to let us know.
And besides that, if I have to get the shot, I will get the shot and I'll tell everybody, okay, I have it. No, seriously.
I would too at that point.
I'm not scared.
Right. You refer, I don't know that I've heard anyone refer to themselves as a human guinea pig and be okay with that. Can you talk a little bit about that?
Well,
that's how drug trials happen. That's you can't test all these drugs on animals because the animals and the humans don't always correlate. Somebody's got to do it. And
That's true.
Well, I raised my hand. I'm in.
He went because I went. He's not fooling anybody.
No.
You got him in the
scared,
trial.
okay, I'm not scared. I said, well, I want to try it also. This way I'll find out because I do wear my mask. And the nice thing about in this area, you see everyone wearing their mask. Even the fellows that hang out on the block and the corners in certain areas, they have their mask on. I said, okay, they're in compliance with what they're asking for.
Yeah. We have had at least 2 church members that have died of coronavirus.
Wow.
Yeah.
So you have been directly affected by, losing people that you care about to this virus. Did that play at all? Did that contribute to you deciding to join the trial?
No.
I
was going to do it anyway.
Right.
Okay.
Because right now, see, she has 2. I have 5 people that I know that had that virus that I've gone to their funerals.
Wow.
And I think
that is devastating.
Yes.
You just went to one this morning.
I went to one this morning, and they only had 10 people in the room and everything. And when more people came in, they rotated. This was at the wake park. And
told you had to leave.
They literally told you had to leave. And I did sing before I left. I sang a song for him and everything. But people were outside waiting. But, it's like in and out, fast food. I called it a fast food.
Well, and I think that's why one of the reasons that this conversation is so important and hearing from you is so important because you're directly affected. People, multiple people between the 2 of you who have lost their lives to this really preventable disease that doesn't have to happen. And there are so many conspiracy theories and inaccurate information out there about the virus and about the vaccine for COVID-19. Tell me about the reactions of other people, particularly those in our community, when you mentioned to them that you're participating in a COVID-19 vaccine trial.
They just the people that my alumni members, they're all nurses. You what? Oh, and I suggested that they could participate. This was when I first joined, and it was still taking new candidates. They all said, no way. Now, I do understand that just about everybody's retired, but they're still in the community. They still go to the store. They still want to go to church. But they all shook their heads. Nope. I was really surprised. I was surprised. But there are some that I have talked to since then who are willing to get the vaccine now, whenever it becomes available to them. And they're all senior citizens. Okay, we're all seniors. But they are willing now. Some of them are willing now to take the vaccine. But before, in September, no, absolutely not. So I think talking to people, letting them know that it is safe. This is the only way we're going to get through this does help. It's not the end all. A whole lot more has to be done to get people to understand that we got to get through this some kind of way.
Yes, we do.
And
Yes,
see, I always tell some buddies of mine, I said, well, my medical advisor, which is my wife, I'll tell anybody, my medical advisor. And, I told them about that. They rejected, some of them rejected the fact. Some of the fellows that I used to play tennis with a lot and everything, they rejected. Nope. They were, I use this term, they were scared. Instead of saying scared, they were scared, okay?
That is funny. I mean, but it's not surprising to me at all. When you look at the conspiracy theories that are spreading on social media and in other venues, a lot of word of mouth, kind of person to person spreading of misinformation, it sounds like, Marsha, with your medical experience, that you are one of the trusted voices in the community. You mentioned earlier that, one of the reasons that you participate, or you knew that people would ask you about this and you wanted to be able to speak from personal experience, and that they would value what you have to say about this. And clearly your primary advisee values what you recommend in terms of your health and about this vaccine. Mm-hmm. So as participants in a COVID-19 vaccine trial, these trials are about 2 years in duration. Can you talk to us about the follow-up as a trial participant?
Okay. The follow-up is for 25 months. And what happens is after 6 months, they've been checking our antibodies every visit. So we had antibodies checked before the vaccine was given, 1 month later with the second shot, 2 months later. They're to check them again at 6 months. And I assume it'll be every 6 months after that time. That way they can monitor how long the antibodies last. That will help determine how often we need to get the vaccine. After 2 years, if we still have good antibodies, I don't know if they plan on continuing the study after that, but they do plan on studying for at least 2 years, just to make sure that antibody levels stay up. If they go down after a year, then we know every year you got to get another shot. That's a question that keeps coming up. People want to know, do I have to get a shot every year? We don't know. We don't know. And the only way we're going to find out is for people to stick their arm out and get the antibody levels checked.
Absolutely. It is a key question that many people are asking about. Before we conclude this conversation, is there anything else that you want to share, or any questions that I haven't asked that you think are important to address?
I just hope everybody gets their shot when they can. That's all. Just get your shot.
Thank you.
It just hurts a little bit. Pinch, it's over with.
No, it's not even a pinch. And wear your mask. Wear your mask.
I'm tired of wearing the mask. I'm gonna tell you that right now.
No, I don't mind wearing. I'll put my mask on in a heartbeat.
I didn't say it's not the mind. I'm tired of wearing it.
No problem.
Right. She didn't say she wouldn't wear it now.
Huh?
She didn't say she wouldn't wear it now. She's just tired of wearing it, which I can relate to, and I think many people can relate to that as well. We prefer not to, but we will. And we know it's important.
That's important. Yeah.
So what would you say, I'd like to hear from both of you on this question. What would you say to individuals who are hesitant either about joining a vaccine trial, because there still are vaccine trials ongoing and recruiting participants? And what would you say to people who are, so not necessarily about the trial, but who are actually hesitant or expressing that they won't get the vaccine when it's available? What do you say to those individuals?
Well, go ahead.
You can go first.
Go ahead.
Okay.
I'm old fashioned. I'm sorry. I'm old fashioned.
I would say if someone says that they are not interested, and I'd ask them why. We need to get enough people with enough antibodies in their system so that they can resist the virus whenever it comes their way. We can't see it. We don't know where it is, who has it, and this is newer technology, granted, but the technology that they use to get the vaccines out has been around. It just hasn't been. They've been working on it.
And as far as the scientific, medical aspects of it, they're listening and they're believing that, okay, maybe in essence, I can take this vaccine, but I won't be scared about it. Because a lot of some people I know, they go back to Tuskegee, things that happened down there. And they say, oh, you're a guinea pig? I said, look, I'm proud of it.
Well, people don't understand when we talk about Tuskegee, with the Tuskegee experiment, people are overlooking the fact that people were in the study. The problem with the study was once the treatment was developed, it wasn't offered. If they had been offered treatment in 40 something or other, it would have been a different outcome. They weren't offered the treatment, and I think that's what the criminal part was. And that's not what's happening today.
So I guess if you could give me in a couple of sentences from each of you, what your main, I guess, takeaway messages would be for people who might be listening to this conversation and they're on the fence or saying that they won't get this vaccine. What do you want them to really remember of everything you've shared?
I want them to understand that for 99.99999% of the population, the vaccine is safe. This vaccine will keep them from getting COVID or passing it on, and it'll keep it out of the community so that we can go back to our normal, whatever normal is. It won't be tomorrow. It's going to take a good 6 to 9 months, hopefully. Hopefully. It may even be longer than that. But I think that the people need to listen to the medical community who has the proper information that they're giving out. Because we do have a few people out here in the medical community who are giving out
wrong information,
bad
big time,
information.
very much. They do not have anything to substantiate what is already being taken care of. They don't accept that. They have their own version of what they want to happen, which is not true. And just like Dr. Fauci, I believe in when he tells you something. That's one thing I can say. I believe that. Okay. I say, okay, I'm gonna try it. This was before we got into the program and everything. But I look forward to when we're able to come all the various things that have been going on that we can look up and say, hey, we're there now. We made it possible. And we were a part of it, which is outstanding. As I tell all my
Agreed.
friends and buddies that I talk to, I said, well, when the vaccine becomes available, please, and you're in that age bracket that so you'll be able to get up there, maybe a few months from now, whatever. Next month, perhaps. But I know I'll get it before then, if I don't have it already. Okay.
Wow. No, I hear you. And I mean, what your mom, dad, this has been such an interesting and informative conversation. And I just want to close by thanking both of you sincerely for sharing your personal experiences. It means a great deal to me and to our viewers. This is, as you mentioned, such an uncertain time for all of us. Over 9, almost 10 months now of major life uncertainties. And it is important that we do what we can to contribute to ending the pandemic. And you've done that in multiple ways, including participating in a clinical trial, wearing your masks, physical distancing, and by sharing today, which, that's also another way you've contributed, and I'm sure it's going to help many others, and I appreciate both of you. For more information about COVID-19 clinical research opportunities, or to learn about the COVID-19 vaccine, please visit covid19community.nih.gov.